Hi, Emily. Thank you very much for your flashcard presentation on hypothyroidism. Below is my case presentation on this disease. So, patient AW is a 60-year-old woman who presents for her yearly physical with her PCP today. She states she's feeling well, just has some odd generalized symptoms. She has a history of anxiety and depression, but is otherwise healthy. She has no allergies and no pertinent family health history. She has 2 healthy children and 1 grandchild. When you ask how AW is feeling, she states fine, just that she's been having trouble sleeping recently and constantly feels fatigued during the day. Her vital signs are as follows. Her heart rate is 58, her blood pressure is 109/66, her respiratory rate is 14, her oxygen saturation is 100%, and she is afebrile. You notice that her weight has increased 10 pounds since her last visit 6 months ago. She states that she has not had much of an appetite recently, however. She has been experiencing no nausea or vomiting. Her abdomen is soft, but she states she has been having issues with constipation recently. Her last bowel movement was 4 days ago. Her lungs and heart sounds are normal, though you do notice the mild bradycardia. You ask AW if there was anything specifically that was concerning to her. She states that her hair has been falling out a lot when she takes a shower, and her skin is always so dry. Due to these symptoms, you decide to send AW for blood work. You order a serum TSH, T3, and free T4 level to be drawn due to your high suspicion that she has hypothyroidism. AW symptoms that indicate hypothyroidism as a likely diagnosis are her anxiety and depression, bradycardia, insomnia, fatigue, weight gain, decreased appetite, constipation, and brittle hair and dry skin. The fact that she is a woman over 60 puts her at a higher risk for hypothyroidism. When her labs result, her TSH levels are elevated and her T3 and free T4 levels are low, confirming a diagnosis of primary hypothyroidism. Treatment for hypothyroidism includes replacement therapy of thyroid hormone, available commonly as the drug Synthroid or levothyroxine. Therefore, we prescribe this medication to AW and educate her on the instructions on how to take it. All right, and below are my references. Thank you very much for listening.